And we're occupational therapy students, and we're going to be showing you how to wrap residual limbs today.
Some of the benefits of limb wrapping include reduced swelling, improved circulation to that limb, it reduces pain, and it can shape the limb for prosthesis in the future if one is wanted. Some precautions to know when limb wrapping are to avoid 360 wraps around the limb to avoid cutting off circulation and reducing blood flow to the area. Also avoiding wrinkles to prevent skin irritation from occurring. Also drying the limb before bandages are applied. And also anchor bandages with tape as opposed to pins to prevent wounds from occurring. Also, bandages should be removed every 12 hours or when someone is bathing, or if there is pain, or if it's too loose and becomes wrinkled. In this clip, we are going to show you how to wrap a below elbow amputation. We will be using an ACE bandage that has a bit of stretch to it. You want to begin by having the residual limb in a comfortable position as well as being slightly bent. Wrap the bandage diagonally around the limb to ensure that you are making a figure 8 pattern and not doing 360 wraps. As you continue to wrap the limb, extend the amount of area covered to ensure the entire residual limb is being covered by the bandage. Once you are done wrapping the limb, double check that there are no wrinkles in the bandage and that there are no uncovered areas as shown in this clip. In this clip, we'll be showing you how to wrap an above elbow amputation. It will be the same process as the below elbow amputation. However, after you have wrapped the limb, you're going to want to anchor that bandage by wrapping it across their backs and under their underarms, making a crisscross pattern on the patient's back as shown in the video.
In this clip, we will be showing you how to wrap a residual limb that has been amputated below the knee. When starting with an amputation, you want to make sure that your patient is in a seated position. And for wrapping, you want to use 2 to 3 lengths of 3 to 4 inch elastic bandage. And with these bandages, you want to make sure they are sewn together. You do not want to use metal clips because if you do, you risk possibly puncturing the patient. And prior to limb wrapping or putting on the bandage, you want to make sure that skin and wound care is done. And the most important thing to remember when wrapping the limb is to always do a figure 8 motion. You never want to do a 360 or circular turns because you can restrict circulation to the residual limb. In this clip, you will see what your bandage should look like after completing wrapping. In this clip, we will be showing you how to wrap an amputation that is above the knee. And you will use the same procedure as below the knee, with the only difference being that you will bring the bandage up over the thigh and across the hip joint and also around the pelvis. The bandage around the hip acts as an anchor so that the bandage that is around the residual limb will not fall off. And this is what an above the knee amputation wrapping should look like.